Hi, my name is Professor Adam Winstock. I'm a consultant psychiatrist and addiction medicine specialist. I'm also founder of the Global Drug Survey. In this video, I want to talk about various medication-based strategies to stay sober after you quit drinking. So, completing detox, other than the physical discomfort of it and maybe being away from your family or having to take medication, I don't think is that difficult a procedure to complete. Most doctors, if they manage it well, can get patients through that rocky time. But 7 to 10 days after you've stopped drinking, then what? You suddenly have to wake up to a world without alcohol, and that can be overwhelming, particularly if you're someone who had an underlying mental health problem that perhaps was being treated while you were drinking, but the truth is those medications wouldn't have worked because you were drinking. And so you suddenly are faced perhaps with an anxiety disorder, depression or PTSD without alcohol as a buffer. Or perhaps you're just someone waking up to the kind of realization of what you've been missing while you've been drinking. You might find it difficult to sleep. You might just find yourself disorientated in the world. You might find it difficult to concentrate. And all of those things can lead people back into drinking. I think that's one of the reasons that people may opt to go to a rehab, for example. It might be one of the reasons that people choose to stay in hospital. But the reality is, everyone eventually comes to come home. Now, there are medications that can be used that can help people stay sober. None of these medications are magic wands, and none of them are effective in the majority of people. But I just want to kind of tell you about 3 of them, and I want to kind of give you an idea that these things are available. What I would say about all of them is they all tend to work best when you're motivated, when you take the medication, and when there's someone around to support you. So, 3 different medications. The first one is called Antabuse. That's its trade name. The drug's actually called disulfiram. Disulfiram has been around for the longest, and it was actually identified in Denmark in the 1950s and 60s, where someone realized that people working in a rubber factory got really sick on a Monday morning when they came back from alcohol. And that's because actually Antabuse was something that was used in the vulcanization of rubber. Weird, eh? Anyway, Antabuse blocks an enzyme that metabolizes alcohol. There are some people who come from Oriental countries who have what's known as a flushing syndrome. And these people just drink a little bit of alcohol, they flush, they feel red, they vomit, they feel dreadful. And what Antabuse does, switches off that enzyme. And what that means is, if you drink just a little, you feel absolutely dreadful. You flush, you get tachycardia, your heart races away, you can throw up, you can feel really dreadful. It can be life-threatening. It's an amazing drug if you take it. It works best when people are given it, generally either every day or 3 times a week, by someone who loves them, who's going to supervise them. If you take this drug, it's really important that before you start, you have some liver function tests, and it's also really important that you have this done under supervision of a doctor. We tend not to use it very much in many countries. I think it's fallen out of favour. But if you're someone who's very committed to abstinence, you have someone who's special in your life who cares for you, then I think it's worth discussing the idea of supervised Antabuse with your doctor and to see if that's something they'd be willing to try. Second is a drug called acamprosate, or Campral. This is a drug whose dose is really dependent on how much you weigh, and it's given 3 times a day. And this is a drug that has been found to reduce craving. In clinical trials, it can increase the number of sober days in many people. It's not a magic bullet, it works for some people, and it's really difficult to know who it's going to work for. Whether or not it works in some people is probably down to their individual genetic makeup. But again, this is a drug that can help people stop drinking. Unlike Antabuse, you can drink on top of acamprosate. It doesn't make you violently unwell. It works by changing neurotransmitters in your brain, which are thought to kind of mediate and regulate craving. So again, acamprosate, talk to your doctor, see if that's something to think about. The final one is naltrexone. So naltrexone is a tablet you take either once a day or 3 times a week. And actually naltrexone is a drug that blocks the way that opiates work in your brain. You're right, opiates are like heroin, and naltrexone is a drug that can be used to help heroin users stop returning to heroin use. So what's the link with alcohol? Well, part of the euphoria you get when you drink is mediated by your opiate receptors. And clinical trials have shown that if people take naltrexone, they tend to drink less, they tend to binge drink less, and for some people it can help them stay sober. Now, if you're someone who's taking an opiate-based painkiller, this medication is a no-no. If your liver is a bit up the creek, that can also be a bit of a problem. Naltrexone, like acamprosate, does have side effects. It can give people headaches, it can give people kind of stomach upset and things. And a bit like acamprosate, it works for some people, it doesn't work for others. Again, they're going to work for people who take them, who are motivated. Whether they're the right drug for you, I don't know, but it's worth going along and talking to your doctor. Now, I said I was going to talk about 3 drugs. In fact, I want to talk about 4. The last drug I want to talk to is a drug called baclofen. Baclofen is a muscle relaxant, sometimes used for people with MS. But over the last 10 years, there's an increasing body of evidence that suggests that baclofen might be a useful drug to prevent relapse in people who are alcohol dependent. Unlike antabuse, acamprosate, and naltrexone, baclofen is fairly safe in people who have got quite damaged livers. And I think therefore it's quite a useful drug to explore. Now, the evidence probably isn't as robust as it is for the other 3 drugs, but I think it's worth again being able to go to your doctor armed with this information, or at least discuss it with your specialist. Doses vary hugely depending on what people are able to tolerate, but it's a drug that certainly I think in future is likely to become something that we see increasingly used to help people